Thank you for joining in and tuning in to the second webinar of this series at this year's open enrollment. Yesterday, we hosted the kickoff, and it was a great time where we shared insights for a benefit plan for next year. Today, we've asked Ryan Johnson, which I'll introduce you guys to him in a few minutes, to talk about just a high deductible health plan, talk about the HSA, health savings account, and what that is, and a time for you to join and ask questions live. And so Ryan Johnson, he's our senior partner with the Alera Group. Alera Group is our benefits consultant team that we work with throughout the year, various times. And so we are very grateful for his time and his knowledge and his expertise on the health savings accounts and as well as the high deductible health plan. So without any further ado, I would like to introduce to you Ryan Johnson, and we will talk about today's presentation. Thank you.
All right. Thank you, Marinella. And good afternoon, everybody. I'm glad to be with you today. If you tuned in yesterday, you heard an overview of the various programs that are going to be in place for 2025. The really good news is we don't have any real significant changes. As far as your plan design and your third-party administrator, those will continue to stay with UMR. The intention today is for me to talk through the difference of your high deductible health plan and your standard PPO plan a little bit. And then I will talk about how health savings accounts work. So if you have questions along the way, if there's something that's unclear or you would like me to repeat myself, please unmute yourself and ask a question if you'd like, or if you'd like to save all your questions till the end, I may work through all the answers. So if you want to hold on your questions to the end, you're welcome to that as well. Or if you got something that you want to put in the chat as far as a question goes, feel free to do that as well. We've got about an hour slated here for us today, and I want to make sure that you all get all the information that you guys need to make good decisions for your open enrollments going forward. So with that, I'm going to share my screen, and I'm going to walk through a few items that are all available if you go on to the website and look up the benefit links that were also emailed and mailed out to you. So you all should have access to all the materials that I'm going to share here today. The first thing I'm sharing here is this is a copy of the open enrollment packet that you guys have had access to electronically and also would have received over in the mail as well. So what I wanted to point out in here is we've got an outline of the medical plans that are available for us. So the key thing to understand is you have two medical plan options. You have your standard PPO, and then you have your high deductible PPO. These both utilize the same network and cover the same services. What we mean by that is the same drugs, the same procedures are all covered under both plans similarly. The difference is your out-of-pocket cost. So what you're going to be paying as a member should you go in for care would vary based off of which plan you and your family are enrolled in. So just a really key thing to understand, same network, same benefits, but the cost share is a little bit different. And one thing that does impact a little bit differently is also the Medicare, or excuse me, the Methodist waiver. So the Methodist waiver applies only to those enrolled in the standard PPO plan. For the folks that are enrolling in the high deductible plan on the left-hand side, you are not able to get the write-off of the from if you go in for services of Medicare, but you do have access to a health savings account, which is something else I will provide some more information on. So you can see the two plans are compared side by side here from your deductibles as an individual, $1,850 for the high deductible plan and $1,000 for those enrolling in the standard PPO plan. You can see your family deductibles are shown here as well. So they're a little bit higher on the high deductible plan. When we account for your overall out-of-pocket maximum, though, the overall out-of-pocket maximum is actually lower under the high deductible plan than it is under the standard PPO plan. So there is a difference in cost share of when you're going into the different doctors and facilities of if you're going to pay copays or you're going to pay a different cost when you go in. So that's where we compare and contrast different out-of-pocket differences. And we also have a note here about the Houston Methodist Hospital write-off shown here. So that was, I mentioned a little bit earlier, you are able to take advantage of that with the standard PPO plan, but due to rules and regulations around health savings accounts, you are not able to take advantage of that with the high deductible health plan. So again, same network, just a difference in cost share should you go in for care. So with that, I am going to share what we mean by health savings accounts and some key items for you to be aware of when you're making this decision of what plan is best for you and your family. So in order to open a health savings account, you have to be enrolled in a qualified high deductible health plan. That's that plan that I was showing on the left-hand side, that HDHP PPO. Okay, so the high deductible health plan is governed by the IRS, and it puts limits on what the deductibles, what the out-of-pockets look like, what you're paying for under copays. So essentially, a qualified high deductible plan cannot have copays to go in for service. And that's why we have some of these plan designs that differ from the standard PPO to the high deductible plan. If you are enrolled in that high deductible plan, this is when you can open an HSA. And an HSA is a special tax advantage account where you can put aside money tax-free. All the money that you put in there also can grow tax-free. So you can have it grow through investments. So you're able to open a health savings account with whatever bank that you might prefer, and interest will all grow tax-free. Some banks also will offer investment options. So similar to how you're investing a 401k or any other health plan or any other retirement plans, you can also invest money in the HSA vehicle. Your withdrawals from an HSA are all tax-free, provided they are for qualified expenses. Those are medical, dental, and vision expenses, which I'll cover here in a moment. One of the things that a lot of people think about these are, it's similar to a flexible spending account. One of the big differences, a couple big differences with the FSA and the HSA is an HSA is your money and it's your account, it's under your name, and it's always going to remain your money. So any funds that you have left over at the end of the year will roll over to the next year. So it will continue to build and grow in value as long as you're adding money to it. And also with your investments, all that stuff will grow tax-free, and it's always your money. So whether you are staying with Texas Annual Conference or you move on or retire, whatever that might be, all the money in your HSA is always going to be your money. So you own that HSA. And if you were to change jobs or you change back to the standard PPO plan at another time in the future, that those funds that you put in the HSA are always going to be your funds. You can withdraw the money directly from your health savings account, or you can use your debit card. So a lot of folks will use a debit card. And what that looks like is you're going to have an ID card with your health plan with United Healthcare and UMR, and that's going to give you access to the network discounts with United Healthcare. So you're going to get all the network discounts by using this ID card. You will also open a health savings account, and you'll have a debit card. And this is what you're going to use to pay for your out-of-pocket expenses. So oftentimes folks will use that debit card to pay at the point of service. So at the doctor's office or at the pharmacy, you just use that as any other debit card. One key distinction to know is, I mentioned multiple times here, it's a debit card. And just like it sounds, you can only use money that is deposited in that account. Okay, so it is not a credit card, it is a debit card. So if you put forth $1,000 into that account, you would only have $1,000 access into that debit account. So you can continue to add money throughout the year. As an individual, you can contribute for the 2025 tax year up to $4,300 per year. If you're enrolling yourself plus dependents, so that's we're listing it here as family coverage, but that encompasses employee plus spouse, plus child, or plus family. The maximum limit is $8,550 for 2025. If you, excuse me, if you're over 55, you can add an additional $1,000 to those maximums. And so this is the annual maximum that you can do. You can choose to put all of that money in January 1 if you wanted to. So you could deposit those funds right away once you are enrolled in active on that high deductible plan. Or you could choose to build monies over time. So you could add $100 a month or $100 per paycheck, however you want to do that. It's up to you. But just remember, the money that you are depositing in there is only available once it's deposited. So some folks may choose to front end load or deposit more money in the beginning of the plan year. That way that money is there. So you could say you put $1,000 in the first week of January, and then you maybe make $50 per check after that. It's really up to you how you do that. You don't have to do an even amount. You could do a different amount every single month if you wanted to do that. Again, this is just a tax advantage vehicle for you to put aside your money that you can then use for qualified expenses. So as I mentioned before, in order to be enrolled in this health savings account, the IRS has some rules. You have to be covered under a qualified high deductible health plan, which is what we have in place with the HDHP. You cannot also be covered by a non-HSA qualified plan. So you could not be enrolled in another copay plan with a spouse and also be enrolled in a health savings account. So in order to be eligible for the HSA, you essentially cannot have copays under your health plan. You also cannot be enrolled in Medicare or TRICARE. Okay, those are also benefit programs that would disqualify you from adding money to an HSA. As I mentioned earlier, though, if you were to retire and go on a Medicare, the money that's in your HSA is always your money. You just can't add to that while you are also enrolled in Medicare. Okay, so you could enroll in Medicare once you turn 65, and if you have, $10,000 built up into your HSA, you could continue to use that $10,000 until it has depleted down to zero. You just not be able to add additional monies into that HSA once you're enrolled in a non-qualified health plan. You can't be claimed as a tax dependent on someone else's tax returns. You cannot receive VA benefits, at least for the past 3 months. And you or your spouse, you also are not able to contribute to a healthcare flexible spending account. That would be if you have maybe eligibility through another group health plan. It is a member's responsibility to determine your eligibility status for a health savings account. Remember, Texas Annual Conference is allowing you to enroll in the high deductible plan. It is going to be up to you as an individual to determine your eligibility for the additional health savings account that you're eligible for under the HDHP. Contributions. So again, employees can fund the HSA with tax deductible money. You can fund it throughout the entire calendar year 2025. And similar to an IRA, you do have a window of an additional time that you can fund it into the following year, which coincides with your tax day of April 15th. So you do have some additional time to fund the HSA if you wanted to. This also applies to people that have been enrolled in the high deductible plan and the HSA in 2024. You have time remaining the end of this calendar year to fund your HSA, and you also have some time up until April 15th of 2025 to fund for your 24 elections. Your elections, as I mentioned before, can change on a month-by-month basis. So you can set a specific amount that goes on an auto withdrawal or auto funding, or you could choose to change it as you need it, or maybe as you're seeing the need for more healthcare throughout the year. If you are funding a health savings account, you can do the contributions directly and file a form 8889 So if you're depositing those monies from say a checking account into a health savings account, you could make those deposits, and then you would just reconcile that when you file your taxes to get the pre-tax benefits. Alternatively, based off of your church location and how you're doing your payroll right now, you may be able to have your church deposit pre-tax payroll deductions into your HSA. So check with your specific location on that to see if that arrangement can be made on your behalf. I also mentioned earlier, you can open your HSA wherever you'd like. So you can use your preferred bank if it's, Fidelity, Wells Fargo, wherever it might be. We've included a link here to a company called HSA Bank. So if you wanted to open a health savings account and you don't have a preferred vendor already in mind, you can use HSA Bank. It's a very popular, very well-known bank that you can choose to use if you'd like to. But really, you can open that wherever you'd like once you are enrolled in a high deductible health plan. Your distributions are all tax-free, provided you are using your monies for qualified medical expenses. You can see the IRS code, it's 213D if you wanted to look it up online. You also could go to IRS's website, but really it boils down to medical expenses, dental expenses, and vision expenses. And we put here a few examples of what these items look like. If you are using your HSA for non-qualified expenses, you're going to be subject to income tax and an additional penalty of 20%. Okay. So if you are funding your HSA and you wind up using it for Christmas presents, you should not do that. You are going to be subject to pay the income taxes that you avoided initially, and then an additional 20% penalty. That penalty does not apply for folks once you're over the age of 65. So this can be used as an additional retirement vehicle. Some might look at it as well, because you're able to put aside monies on a pre-tax basis that can then be used later on in life. I cannot give you tax advice. You may be subject to paying income taxes on this, but you would not have the penalty. For 2025, as mentioned in the call yesterday, the contribution percentages have not changed. This is a percentage of pay, and you can see from an employee only, you're going to pay 3.25% of your annual pay towards the high deductible plan. And if you're enrolling the standard PPO plan, you're going to pay 6.75. If you're enrolling your spouse, children, or family, you're going to have additional contributions that you would make that you can see outlined on the charts here. So you can see on the right-hand side, the standard PPO plan is going to cost you more in payroll deductions. I also mentioned earlier that the high deductible plan has a lower out-of-pocket max. So there are potentials for you to actually save a lot of money if you enroll in the high deductible plan. And the next couple slides, I'm going to walk through a few case studies to show you some examples of what those cost shares might look like. And again, this will be available for you online. And so you could do the same math based off of your particular situation and what those expenses have looked like for you as a family and what you're anticipating for 25 to figure out what might be the best situation for you.
Brian, we have a question on the chat.
Okay.
I think this is a good time to address it. Rochelle asked, what if a households have two different health plans and both are enrolled in a high deductible health plan? Would they set up a single or family HSA?
A good question, Rochelle. So I have to be very careful. I cannot give anybody specific tax advice, but what I can generally give you guidance on is you have family limits and it's based off of a family. Okay, so it all comes down to how you're filing your taxes. So this is an individual limit and this is a family limit. Okay, so if you have a husband and wife that are enrolled separately, there is still a maximum that you as a family can contribute between those two separate HSAs. Oftentimes you might have a family that is enrolled maybe on two separate health plans, but they have the same health savings account if you're doing your taxes jointly as a family. So I hope that answers your question without me getting specific about your specific family. But just know these are limitations. And if you want to look up the limits for an individual, you can look at the IRS tax code, or you can check with your CPA about your specific situation. Yes, John Stevens, I see a question here. Can the employer contribute to an employee's HSA? Do the limits remain the same? So these are limits on a personal basis or a family basis, which would encompass the employee plus an employer's contribution. So an individual enrolling in single coverage cannot have more than $4,300 a year in contributed into their HSA between themselves and their employer. Texas Annual Conference does not fund HSAs, but if you are getting funding from another employer, you would need to reduce the amount that you're contributing to make sure that between your employee contributions and an employer's contributions, they do not exceed the IRS limits. I'm going to pause here for a moment to see what other questions we might have before I move into the case studies. Okay. I'm going to move forward. Again, I'm going to show this. I think this is a really helpful grid. This, again, is in the materials that have been sent out, and you should have it in your mailbox. It shows the deductibles, the out-of-pocket maximums, and your copays, if copays do apply, what those copays look like. Okay, so under the standard PPO, if you go into a primary care physician, you're going to have a copay of $25. If you're going to see a specialist, you're going to pay $40. One of the big differences on the high deductible health plan is we do not have copays. It is part of the IRS rules that you cannot have copays prior to a deductible. Okay, your deductible is $1,850 here. So what that means is for an office visit, you're going to pay the contracted rate that that particular doctor or hospital has with United Healthcare, with UMR. So once you pay your deductible, you then have coinsurance, and it's an 80-20 split. So if we break this down into some practical application, you'll see this on the next slide. I'm going to try to keep these both visible at the same time to help you understand how these plans work. So if I move that here, you should be able to see both of them. I'm just trying to show the high deductible plan benefits over here. So if I am say I'm a healthy single person with minimal expenses throughout the year, if I use the annual deductions, I'm making $90,000 a year, I'm going to pay 3.25% of my pay, which is $2,900 to enroll in the high deductible plan. And if I enroll in the standard PPO plan, I'm going to pay $6,075. So I'm going to pay significantly more to be enrolled in the standard PPO plan. That does give me the benefit of copays if I go in for services. So again, remember I mentioned that you're going to have copays under the standard PPO. Under the high deductible plan, you're going to pay less money up front, and you might pay a little bit more money along the way. As an example, you have under the HDHP, you'd pay an office visit, which might be $110. Again, it just depends on what that particular doctor contract, what that looks like with United Healthcare. Under the PPO, you pay $25. So I'm going to pay less on the standard PPO for my office visits. And we're using, let's just say we're taking one drug, and it's a generic drug. It costs $15 either plan that I'm on. So it's an inexpensive drug. So that money is going to be similar on both of those. But I'm going to pay more under the high deductible plan for that office visit. So my total out of pocket on the HHP is $400 versus $230. When I add my out of pocket back to the salary deductions, I get my total cost for the plan for the year of $63.05 under the standard plan and $33.25 under the HDHP. So I'm saving about $3,000 to enroll in the high deductible health plan. So I would suggest everybody look at their particular situation of what their utilization looked like last year and what they anticipate to look like in the future. And you actually can see what the contracted rates are, what the negotiated rates are on your explanation of benefits, that you can look those up. And you can see what those fees, what those costs would have looked like if you did not have copays. If we are looking as this is an employee only. If we're looking as a employee plus family, we're walking through again another financial scenario. On the left, this is our cost to enroll our family. Again, we're using a $90,000 salary. So I'd pay $86.85 to enroll in the high deductible plan, and I pay $14,085 to enroll in the standard PPO plan. Now, let's say we wind up hitting our out-of-pocket max. So we have multiple people that have various procedures or various costs throughout the year. Under the high deductible plan, I have an out-of-pocket max of $10,000, and my pharmacy out-of-pocket max is included in that. Under standard PPO, your out-of-pocket max is $10,000. You have an additional $2,000 in your pharmacy out-of-pocket max. So my total out-of-pocket max is higher under the standard PPO. So what we're showing here is your salary deductions are going to be higher under standard PPO. Your out-of-pocket max in worst case scenario would also be higher under the standard PPO. So I'm going to spend more under the standard PPO by about $7,400 than I would under the HDHP in my worst case scenario throughout the year. Now, there's a lot of in-between situations that you could run through the math of. Let's say I don't hit my out-of-pocket max, I hit a portion of it. So you can put some pencil to paper and figure out what it might look like for you. I will pause again to see what questions we might have. We have a question. So what is the benefit of a PPO? So to be clear, it's I believe what you mean is of the standard PPO, which is the name of the plan. But if that's not your question, a PPO is a preferred provider organization. What that means is the carrier, in your case, United Healthcare, has contracted with various providers and that have agreed to a fee schedule. That fee schedule is keeping your costs down and known should you go in for care. You as a PPO, you have in-network benefits of deductibles and out-of-pocket maxes. If you also do have out-of-network benefits, and that's basically what a PPO means. But if your question is what's the benefit of a standard PPO versus the high deductible plan, again, it's the same network. We're covering the same things. It's just a difference in cost share. So under the high deductible plan, you are choosing to have less taken out of your paycheck initially. If you have office visits on the way, you're going to pay the full cost of those office visits. You're going to pay the cost of your prescription drugs until you reach your deductibles and your out-of-pocket maximums. Under the PPO, though, you have copays. So there's more predictable cost should you go in for care because you have a copays of $25 or $40. So there are some, I say, give and takes on this. You just have to figure out what you would prefer is best for you and your family. I hope that answered your question there, Yesley.
Yes, it did. Can I just ask verbally?
Please.
Oh, okay. My other question is, I guess I don't see it, but if it's like a hospital visit, and it's in network, what do you pay with the standard PPO?
So with a standard PPO, hospital stay would be likely subject to your deductible. Okay, so we have this outlined right here. So let's just say, for instance, you go in and you have a big procedure that's done and the bill is $10,000. You're going to pay your deductible, $1,000 under the standard PPO, and then you're going to pay co-insurance for the remaining amount. So 10,000 minus 1,000 is $9,000. So I'm going to pay 20% of that $9,000 until I reach my medical out-of-pocket maximum. Under the high deductible plan, same scenario, $10,000 bill, I'm going to pay my $1,850 deductible. The remaining amount, which is $81.50, I'll pay 20% of that until I reach my out-of-pocket max of $4,500 here. Okay, so our out-of-pocket max is the same between both plans. If I have pharmacy, under the pharmacy, we have on the right-hand side, we have a $50 deductible, and then you're going to pay 20% of the cost after that deductible. For your pharmacy under the high deductible plan, you pay 20% after the deductible as well. So the plans operate just a little bit differently, but the short answer, yes, Lee, is it would be subject to your deductible if you're going in for an inpatient stay.
Okay, thank you.
You're welcome. What other questions do we have? Feel free to unmute yourself, or you can put it in the chat. One thing I really want to make sure to emphasize on this, there's not a gotcha here. Folks that enroll in the standard PPO plan, these plans have been around for many, many, many years. High deductible health plans and savings accounts have been around for about 20 years. And they are a very popular plan. The idea behind it is we have lower costs up front, and it's a pay-as-you-go approach. Both of your plans are very rich benefit plans, meaning there's very low out-of-pocket costs under both of your plans. The reason the high deductible plan costs less is because we typically see better utilization patterns in high deductible health plan participants. So that's why the cost to participate on that plan is a little bit lower. So there is actually an incentive, if you will, to enroll in the high deductible plan, even if you don't open an HSA. So part of what we talked about today was opening a health savings account that helps you put aside more pre-tax dollars to pay for it. You have some additional benefits to enroll in that high deductible plan. But if you're just looking at it from a pure dollars and cents, you can see that the dollars can be substantially less if you enroll in the high deductible plan. One of the drawbacks might be somebody that looks at an office visit and says, I don't know what that office visit is going to be. I would rather have the predictability of $25 versus or $40 for a specialist. But if you go in for a specialist office visit under the high deductible plan, it's going to be the contracted rate after you hit your deductible or before you hit your deductible. That could be $300 for a specialist. It could be $900 for a specialist, depending on what they're doing. So some people like that predictable copay as opposed to saving money up front and then paying a little bit more potentially when you go in for care. Give us more time for questions. One of the other items that is in the materials that you guys have received and that you also can find on the website is an overview of understanding high deductible health plans and HSAs. So a lot, if not everything that I covered here today about high deductible plans and HSAs, how they work, what the limits are, has also been provided to you guys through this PDF. So you can look this up on the website and make sure that you're well versed and have a good understanding of how the plans work. And you can also look up various IRS websites if you want to learn a little bit more about how they work and how to file for your taxes. Marinelle, what other questions do you typically get from folks, if any, that we haven't covered today when they're asking about the HSAs or high deductible plans?
I think John's question is very reasonable, and it's one of the ones that I usually get regarding the employer contribution to HSA. So I'm glad that he asked that and you were able to respond. Another point of clarification too, I know that you mentioned it at the beginning, but I got a direct message about is on Yesley's hospital question. This person asked, well, what if they're going to Houston Methodist Hospital? And so I know that you clarified in the beginning with this chart that eligible for the Houston Methodist write-off coinsurance and deductibles is only available in the standard PPO plan, not the high deductible health plan due to the IRS HSA rules. So I just wanted to be clear about that and to the conversation that I was having directly.
Great point. So, and I'll add a little bit more as we're waiting to see if anybody else asking a question. So what we have in place with the conference's health plan is a direct contract with Houston Methodist. What that means is we have a reduced rate when you go to Methodist compared to what they would charge another customer with a different health plan. Okay. So that is one component of the contract we have in place with them. The other component is this deductible and coinsurance write-off. What that means is when you go in for care, it says that you've hit your deductible, but they don't actually collect that from you. So it's a non-collection agreement. So they waive the deductible and the coinsurance that you would need to pay to Methodist Hospital when you're enrolled in the conference's health plan. Because of the IRS rules, as Marianelle said, under the high deductible plan, they cannot waive that write-off. Okay, so everybody has access to Methodist, and both plans are getting the contracted rates that we've negotiated, but you would be subject to your deductible and coinsurance under the high deductible plan at Methodist, whereas the standard PPO, Methodist is waiving your out-of-pocket max and deductibles. We have a question here. What is the contracted rate for an office visit before you've met the deductible on a high deductible health plan, or how do you know how much it will be? Really good question. I alluded to it a little bit earlier, and we showed it on this chart here. A primary care office visit might be, oh, that advanced, I didn't mean it to, might be $100, $150. It depends on what that particular doctor or physician has negotiated with United Healthcare. So this is 110 is an estimate. It could be higher, it could be lower, based off of your region, based off of the doctor, and based off of their contract. A specialist office visit may be 2 or 3 times that amount. So let's say you spend $110 for a primary care visit, but you're going to spend $300 for a specialist office visit. So it can be more under the high deductible plan initially with your out of pocket. Once you factor in your salary deduction difference, though, the salary deduction difference likely makes up for more than what you might pay in a total out of pocket.
Ryan, is there a way to know someone that is currently in the high deductible health plan to call ahead and ask that doctor what their fee is? Will they give that over the phone, or is it kind of a surprise sort of thing? You're in the appointment and here's your bill?
Great question. I wish I had a better answer for you on that, but it is something that often when you call the billing clerks, they're not able to tell you. They're going to say, yes, we are in network with United Healthcare, but I don't know exactly what the contracted rate would be. Sometimes what they will do is they will charge you an amount that they make up. They say, oh, I'm going to charge you $50 today. We know it's probably going to be more, but today I'm going to charge you $50. And if, the contracted rate turns out to be $125, we'll bill you for the remaining $75 later. There's not a lot of really great publishing of these types of expenses. It's also going to vary based off of what that doctor does in that office visit. So an office visit, kind of behind the scenes of how these health plans work. If I pull this back up, your office visit is $25. What the health plan pays might be $200. It might be $400. There's various procedures that can all be encompassed within that $25. This is just what you are charged, and then the health plan, your conference is self-funded, so that your conference actually pays the remaining balance of whatever's billed from that. So it will vary based off of what you're going in for. Something that's really important to look at as a distinction: both plans have preventive care at no cost. So if you're going in for your annual checkup, so your annual well woman, well man exam, whatever that is, it's not going to cost you anything under either plan. Okay. The exception to that is if you go in for that annual checkup and then you also start talking about other things that you'd like the doctor to look at, or you're trying to get a prescription filled, they then change that from a free preventive visit to a diagnostic office visit. And that's where you might be subject to your copay under a standard plan, or if you're in the high deductible plan, that's where you might want it paying, 60, 80, $200, depending on what they're asking about and what they're following up with your procedure on. What other questions do you all have or experience do you have? I've worked with the conference now for a number of years, and on the board, we've had a lot of really good feedback from some of the board members that have been enrolled in the high deductible plan. That what they said is after they were exposed to understand the numbers and paying attention to it under a little bit more scrutiny, they put some pen to paper and they found out that the high deductible plan was a much better benefit for them and their family when they looked at the dollars. So it's something to, I'd say, do the math on for yourself. You can see that the out-of-pocket max, so your worst case scenario, is lower under the high deductible plan, and your contributions also are lower under the high deductible plan. So the way I think about that is your best case scenario is you go in just for your annual checkups and you have nothing else. If that's the case, you're better off on the high deductible plan because you had lower employee contributions throughout the year. The flip side is your worst case scenario is you have to pay your premiums and then you also hit your out-of-pocket max. Since your out-of-pocket max is lower under the high deductible plan, you pay less in premiums and you have a lower out-of-pocket max. So in the end, you pay less for your plan for the year. And that's what we're showing on this last slide here of your worst case scenario is that enrolling your whole family is $18,685 compared to the standard PPO is $26,085. The exception to that is not being accounted for in here is the Methodist write-off. So if you were to go into Methodist for all this care, and this is all your deductible and co-insurance, this $10,000 essentially is waived. So you would reduce this 26 by 10, that gets you to 16,000. And so that 16,000 is a little bit better than the 18,000 over here. We have a question about preventive weight loss benefits in our plan. Marianelle, I do not remember that off the top of my head. Do you recall?
We do offer bariatric surgery. I think the question that she's trying to make, correct me if I'm wrong, Reverend, and you can unmute yourself and say so, but I think what she's talking about, if there's any actual preventive benefits or maybe weight loss benefits in our plan. Rolling 1/1/2025, we will be implementing a new wellness program called Wellness Plus. And in that Wellness Plus program, we have different solutions that you might want to look at. One of them is called Real Appeal, and it's a weight loss tracker that will help you lose weight, and has very exciting things that you can accommodate for and be on the lookout. We're also going to be unraveling UMR's One Pass Select, which is a gym membership as well as home delivery. So we will have things that you can use next year to potentially help you lose weight other than a medical procedure like a bariatric surgery. So I think I answered your question, but if I didn't, please let us know.
Yes, thank you, both of you. You somewhat answered it, but it's in regards to preventive weight loss options other than, bariatric. Of course, now I know it's covered in the plan beginning January 1, 2025. But there are other options now available, but it's been an issue in regards to, and again, same with bariatric, meaning that it's with the doctor's consult in approval of what that patient needs. So preventive measures such as medications and things such as that. I'm just curious to see if there were any additional options that would be available. They're currently not available, but I was just curious to see if there has been some conversation had of opening up other alternatives other than the evasive measures of a surgery in regards to that. So, but I believe you answered my question. Thank you.
Thank you, Reverend. Yes, these will be the alternative for 1/1/2025. And I just want to be clear that we've always had the bariatric surgery available, even in our prior contract with Boone Chapman. The bariatric surgery rolled over when we joined UMR this year, 1/1/2024. And so, and to that extent, it's in this chart that Ryan has. If you scroll all the way to the top, Ryan, there is information about the language that has been changed for bariatric surgery, and you can look into that in this open enrollment packet. Before with Boone Chapman, the bariatric surgery was very rigorous and had very specific language and eligibility for you to be able to qualify for. With our UMR contract, we eliminated that. So bariatric surgery, if you're eligible to it, your doctor would sign off on that and it would just go through our plan. So I just wanted to be clear about that, and further information about bariatric surgery can be found in our plan document online as well.
Really good questions and clarifications. Any other questions that we can help address, whether it's regarding the high deductible plan, HSAs, how they work, or anything else that we can help provide some clarity on?
I did receive a direct message. Someone has asked if the the current wellness program, will it be also available next year, starting 1/1/25, and it will be not. So the current TAC wellness program will cease December 31st, 2024, and the new Wellness Plus program will enroll effective 1/1/2025.
These details you can see start on page 8 of the benefit booklet that you all have received. Part of the feedback that we received from those that participated in the survey was they wanted to see more holistic well-being solutions. And so we reviewed with your group health benefits board various options and put in place what you're seeing here on the screen, effective January 1, 25, that has additional coaching and programs to help you with a more holistic well-being approach. There was a lot of conversation about this yesterday. If you want to go back and review the recording from Monday, the 28th, we did go through the details of these various programs. There's a lot of them, which is great. It's a lot of really great opportunities to help you engage and really help take really good care of yourself, and also help with your health and the health of the population as a whole, and cost saving initiatives as well.
Thank you, Ryan, for your time. We appreciate your time on this topic because I know that you are really good at it. I just want to remind everyone, in case you're interested, right at 2 in a couple of minutes, we will be hosting our first Medicare enrollment webinar with the Medicare expert, Michael Steele. So I'm encouraging you to go. to the webinar. The link has been sent out via email in case you want to hear and the information and maybe you have questions. So want to invite everybody right here at 2 p.m. The link has been emailed to you and hopefully you can join us.